All right. Debbie, did you want to introduce Anna
I
and
do.
kick us off? That would be wonderful. Thank you.
I do. Thanks, Rebecca. So, Anna and I first crossed paths probably 15 years ago when she was the executive director at Freed Center for Independent Living in Grass Valley. And we were advocating for better state investment and organization around transitioning people out of skilled nursing facilities back into community living. And she was a warrior advocate for people living independently in community with the support they need. Imagine that. We have a little bit of mission meld in our humanness. And and then she went to the dark, no, just kidding, not the dark side. But she left the world of nonprofit and went into state service. Um she most recently in her state service roles has landed at the California Department of Aging. She is now the Assistant Deputy Director for the Division of Policy Research and Equity. She collaborates with federal and state partners as well as California's Aging and Disability Networks to support efforts that improve the lives of older adults and people with disabilities in California. And she graciously agreed to come on here, sight unseen of what this group was, to help us navigate through how we protect, serve, honor, and connect our older adults when we have this unprecedented growth in this segment of the population during threats and crisis and terrible times right now. So without further ado, Anna.
Thank you so much, Debbie. And so appreciative to be here. And actually, just to see the cross sectors represented within your group is really powerful. And I really hope that I'm going to go over some slides just to kind of set the tone, but I really want this to be a discussion and kind of learn from you and see what I can help support with the work that you're doing. But I love that we have like county and healthcare and behavioral health and senior services and housing, it looks like. And I'm probably missing something here, but like great to see all of you together. I'm going to see if I can share my screen here. Sometimes I'm better at this than others. And let's see if I can. One second. Sorry. Let me do this. Is it sharing? And then, can you see my slides?
Yes.
Okay,
Yes.
perfect. Okay, so thank you so much. As Debbie had mentioned, I've been working with the Department of Aging here actually just over a year. And prior to that, I worked at the Department of Rehabilitation, but most of my work has been at the local level with an independent living center. And we did a lot of really cross-sector, cross-systems work. One, to throughout my career, to bridge aging and disability, knowing that a lot of older adults have very similar needs as younger people with disabilities, and worked across healthcare with the local hospitals, primary care, FQHCs, behavioral health, housing and homelessness at the local level to really help coordinate and streamline access to services. Personally, I'm a person with a disability myself. I was in a car accident when I was in high school. I use a wheelchair. I'm also a family caregiver to my mother, who's 82 years old and lives on the same property as I do. I live in rural Nevada County in Nevada City and come down to Sacramento a couple times a week, working for the state, but really I'm rooted in kind of a rural community and have done a lot of my work in a rural setting. So just Department of Aging, we are a very small department, I would say, about 300 staff under the Health and Human Services Agency. And we administer programs that serve older adults, people with disabilities, and caregivers. Some of you may be familiar with your local area agency on aging, community resource centers. We also administer our CBAS, our community-based services program, and we have a multi-senior services program as well. But what I do here at the Department of Rehabilitation is less on the program side and more in the policy and planning side. It's sort of a dream job, I will just say, being in this position and working with this team. But we really are the State Department that facilitates, I think that's the best term for it, facilitates California's Master Plan on Aging. And so I want to talk a little bit about that. We know that California's older adult population is growing faster and becoming more diverse than any other age group. And we estimate by 2030, nearly 10 million Californians, about 1 in 4, will be over the age of 60. So really recognizing that significant demographic shift that we are under right now and in, Governor Newsom issued an executive order to calling for the creation of a state-level master plan on aging. And this is really a multi-sector 10-year blueprint towards building a California for all ages and abilities. And this really, the master plan on aging is a public and private partnership, because not any one of us can do this. We need to collectively work together to plan and meet the demand of our aging population. We really see this as a whole of government approach. So many state departments are engaged with the master plan on aging, state agencies, our governor's office, administration, the legislature, but also all of a society kind of approach where all of you at the local level and others are really, working towards addressing both the current and future needs of people with disabilities and older adults and caregivers in California. So the master plan on aging, we are in our 5th year, so we're halfway through basically. Every 2 years, we put out a whole new set of initiatives. So those initiatives are really to support the 5 bold goals of the master plan on aging. So that's housing for all ages and stages. Health Reimagined is the second one. The third goal is inclusion, equity, and not isolation. Goal 4 is around caregiving that works, and goal 5 is around affording aging. I can give you guys some links at the end of my presentation, because I'm really bad at doing it while I'm presenting. But there's a wealth of information on the master plan on aging that you guys can tap into. For the current 2025 and 2026 2-year stretch, we have 81 new master plan on aging initiatives that are building on the work of prior initiatives that have been done. At this point, we have hundreds of initiatives that have been highlighted and worked on over these last 5 years. And we really have been focusing on delivering results with an emphasis on increasing the number of people reached and or improving the quality of services provided, or both, hopefully. And just to kind of note that the initiatives you find in the master plan on aging are really based on available resources and ongoing budget changes. We are working also to analyze our data, policy funding, and programs to drive systems change. And we really have been focusing on communicating information and resources to the public with a commitment to equity, language access, and disability access. So we have the master plan on aging. We do an annual report every year. If you haven't read it, I encourage you to. And then we renew our initiatives. We also have a master plan on aging, what we call a data dashboard, where we pull together important demographics. We have county level fact sheets that might be relevant to the work that you're doing. And then we also have a wealth of resources on our website on various initiatives that help support the master plan on aging. So as part of our master plan on aging work, we are very much rooted in stakeholder engagement. When we talk about stakeholders, of course, we have the state departments and the administration and the legislature, but really people like you, individuals with lived experience, older adults, people with disabilities, caregivers, providers across health and social services sectors at the local level and the state level is really the basis and kind of foundation of the work that we do, because on a policy and planning level for the state, right, it's really easy for us to, kind of get ahead of ourselves and think something is a good idea, but if it doesn't actually work for the local community, the county, the individuals that we serve, it really doesn't make sense. So we really root a lot of this in our stakeholder engagement. We have we always say 6 stakeholder advisory committees, but now really at 7. And these really cross various different aspects. One around looking at the impact of the master plan on aging, and are we following a North Star that's really meeting the intent of the goals within it. We also have our Disability and Aging Community Living Advisory, which is If any of you know about the Supreme Court Olmstead decision that said that people with disabilities need to live in the most integrated setting, that group really focuses on community living and services for people with disabilities, older adults. And then we have a committee that's focused on justice, elder and disability justice issues, the prevention of scams and fraud and issues that we see come up in the aging space a lot. I'm sure some of you can relate to that with people that you know or family members. And then equity is another piece that one of the committees really focuses on. We also have an Alzheimer's disease and related dementias advisory committee, and then we have a research partnership looking at the data and what research is out there to see if we are moving the needle on any of our goals and intended outcomes. And then lastly, we just started an aging and disability lived experience advisory body, which really supports all of the advisory bodies and really ensuring that those people with lived experience have a voice in the policy and recommendations. All of these committees, just so you know, we do open recruitment. If any of you are ever interested, we just finished a recruitment. We'll be doing another one in probably a year or so, but we encourage representation across the sectors and individuals like you or that you work with that might be interested in bringing the voice of your local community to the state planning and policy. We always are welcome to get new members and to make sure that we have diverse voices throughout California. So I wanted to kind of talk just a little bit to frame it around kind of our master plan on aging and looking at long-term services and support systems change efforts. When we talk about long-term services and supports, we're talking about a broad range of services, programs, supports that that help individuals live and have the best quality of life and access to the services that they individually need. So it can be anything from in-home care to transportation even, and healthcare and things that really help, home modifications maybe, and a wide variety of services that might support that person with a disability, older adult or caregiver. So we've really framed it in these kind of 4 pillars around our systems change efforts as a state. Of course, all of this is very person-centered, and we talk first about navigation. We really are looking to see how we can streamline navigations to services and supports. We do a lot of stakeholder engagement, not just in the committees. We do interviews, we do listening sessions, we do surveys, and every time this issue comes up, people don't know what services exist. They don't know how to access them. They don't even know where to go. We know that the services and supports in California are across multiple state departments. There are multiple local community providers providing different services. People don't know what's out there, what the eligibility criteria is. So how do we help individuals navigate to those services? The second piece to this is once you navigate and find the service finally, can you access it? Is there a wait list? Does it have the capacity, right? We know there are certain programs that are really important for individuals that might not be statewide. They only might be in certain communities. So what do we do to build the capacity and improve the access to those services and supports? And then the third piece is building a qualified workforce to support older adults and people with disabilities. And this, of course, there's someone here. We have community colleges here with all of you, but there was also the workforce development, I thought. Did I hear that right? Yes, Workforce Development Board. But the piece here is how do we build a qualified workforce? We know there's more individuals aging. They're going to need more services and supports. There's less younger people that might be available to provide those supports. How do we build that qualified workforce? And then the fourth piece is around financing. Really exploring financing options for older adults and people with disabilities. And I'm going to talk a little bit more about that. So as part of this, this is available on our website, but just wanted to make you aware that there was a home and community-based services gap analysis that was conducted last year. So the Department of Healthcare Services did a Medi-Cal specific HCBS, home and community-based services gap analysis. They released it And really looking at the Medi-Cal programs throughout the state and then see what they could do to, one, identify the Medi-Cal programs, but then also see where those gaps in services are, and then work on a roadmap to help address some of those gaps in services. Well, Department of Aging did the same thing, but we did it from a non-Medi-Cal HCBS gap analysis lens. So these are the services and supports that might be out there that support people that may be on Medi-Cal, but Medi-Cal eligibility isn't a necessity to access these services. So these are things that we talk about as our Aging and Disability Network, right? And these are things like the Area Agency on Aging. How about the regional center that serves individuals with intellectual and developmental disabilities? Independent living centers, you have a few of them in your area. It seems like Alameda and Contra Costa that you represent there. Your caregiver resource centers. We also looked at housing supports and services as well as transportation, since those are two of the critical pieces. And then we looked at publicly available data. We hired a consultant to work with us on this, and basically we're able to identify over 380 distinct types of non-Medi-Cal HCBS across California. And we kind of looked at different domains of services that are available to individuals in California. These were things like caregiver supports, communication, information, and referral services, health-related services and supports, maybe like adult day services, durable medical equipment, falls prevention, health promotion. We also looked at housing pieces, housing supply, housing finance options, and then things that will help individuals who are either at risk of homelessness or experiencing homelessness. We also looked at safety issues around disaster preparedness. We know older adults, people with disabilities are often disproportionately impacted when disasters occur. We looked at social inclusion, employment, and economic supports, those things that help encourage civic engagement, participation, and foster opportunities for volunteering or employment, even as older adults or if you have a disability. We then looked at transportation as kind of the final bucket about looking at our paratransit, our public transportation systems, and what's available out there. So we wanted to, I'm not going to go too deep because of time, but we found some overall findings from our HCBS gap analysis that we will then be working on a roadmap to see what can we do. Now we're in a budget, we're in a budget, situation here in California and on the national level. And so a lot of things, it would be great to have the funds to help build capacity and expand programs and things like that. But we'll also be looking at the things that can be done to help improve access and fill in those areas. We found some specific barriers for people in rural areas, those who have English as a second language, those that are historically marginalized from historically marginalized communities, or people with complex health needs as having some specific gaps that were identified there. So I'm going to move on and just know that this is going to be a resource for you. In addition to the report that's there, we have a digital landscape tool that will be available to state and local planners and policymakers. So there's a county by county geographic map of both the Medi-Cal and non-Medi-Cal HCBS available in your local community. So that would be available to you. Now, just know this is not designed for like someone trying to navigate to services and access services. Is more designed for those of us who work in the policy planning. Maybe we're writing a grant or want to look at what's available and what the demographics are and services that are locally to help us with our planning. This is a tool for you. So I want to touch a little bit on Behavioral Health Services Act. This is really an area where we see a major need to ensure that older adults specifically get access to the behavioral health supports that they need. We know that with age also comes isolation and loneliness, and there's a lot that can be done around prevention of more exacerbated behavioral health conditions. But we also know that a lot of older adults may be dealing with substance use disorder, maybe dealing with significant behavioral health, maybe suicidal. And so the Behavioral Health Services Act, or Prop 1, as I'm sure you all are aware of, provide opportunities, right, where we really want to see how do we support older adults with behavioral health needs through BHSA and Prop 1? How can they be served through the early intervention programs, the full service partnership programs, and substance use disorder services that will be funded and made available? How do we ensure that those services are available to older adults and delivered in a way that they can access those services easily? We also know that as part of this, the counties are doing their local integrated plans. I don't know where Contra Costa, Alameda, and all of you are in this. This is underway. Some counties have already submitted to the state their integrated plans. Others are in the midst of doing it. Right now, I think they're supposed to be submitting them now with the implementation July 1. But just know that one of the local stakeholders that should be worked with at that local level are people with lived experience, area agencies on aging, independent living centers, other community-based organizations that serve these populations, and then of course behavioral health providers. So really important to think about the older adult component as part of those efforts. As part of this, we developed a toolkit for local stakeholders to help advocate and uplift older adult behavioral health into those local county level plans. And again, I'll put this in the chat later, but we have a county toolkits available for every county. And really, hopefully it could be useful for those that want to really make sure the older adults are included in those local plans. So we talked a little bit about the, let's see, I didn't have many slides on the workforce piece for this, but there is a lot of work we are doing with our chancellor's office as well as LWDA to really look at things like older adult employment opportunities, also looking at caregivers and supporting caregivers. One of the things we're doing is developing trainings right now in collaboration with the Department of Developmental Services that's around training to direct care professionals, direct care workers, and family caregivers on serving individuals with intellectual and developmental disabilities as they age. There are some unique needs for that particular population, and people with disabilities are living longer now. So now people with disabilities are also, becoming older adults. And so really looking at how our systems, our aging networks, our disability networks, our healthcare networks can really ensure that we're supporting older adults, including those with disabilities. One of the really exciting pieces we're working on right now is our LTSS financing and affordability initiative. There's a lot to say here, so I'm going to just use this slide to say that we know that there's a lot of middle income older adults who have a high level of income or resources and making them so they do not qualify for Medi-Cal coverage. But then again, they have not enough resources to necessarily pay out of pocket for their long-term services and supports needs. So we are going to do a report to the legislature by July on this initiative. We had a $5 million investment. Back in the day when there was money in the budget, we somehow got this investment to do this LTSS financing study. So we did a bunch of research and data, stakeholder engagements, we did policy research. We actually did a Medicare HCBS demonstration proposal. Most people don't know that Medicare doesn't pay for long-term services and supports. Medi-Cal does. And so what we see is that a lot of people, when they have high levels of in-home care needs, for example, they'll end up spending down to be eligible for Medi-Cal. And so we wanted to see what could we do as a state, what solutions could be out there to support middle income older adults and people with disabilities to get their needs met without having to go into poverty and onto Medi-Cal to access those needed services. So this study, there's going to be a lot posted on it, a lot of amazing research that advocates, stakeholders can use. And we've kind of defined what the overlooked middle is. These are people living in the community who can basically afford their basic living needs like housing, food, things like that, transportation, but would have to meaningfully reduce their expenditures on those basic necessities in the presence of moderate amounts of paid home and community-based services. So, and these are individuals who don't qualify for Medi-Cal, at least yet. before the onset of their LTSS. And these are people that are like usually within 139% to 500% of the federal poverty line. This is the target for this study. So there's going to be a lot more to come out with this. It's really exciting work to see. We looked at housing equity, and how that can be used to pay for LTSS. We looked at other programs throughout the nation that either expand Medicaid to serve this population or aren't necessarily associated with Medicaid that could be put into place to support older adults to afford getting their needs met. The other piece to our systems change LTSS systems change is around that navigation piece. And so there's a few things that I'm going to go over very quickly, but to give you kind of a broad view of the navigation piece, we really, and we actually just submitted, put a report up on our website yesterday. We were asked to report yesterday at the hearing that Debbie was at on No Wrong Door. So No Wrong Door is really looking at how do we develop state level leadership and local leadership and to help individuals access services across multiple different systems. So it's streamlined for them. They don't have to tell their story multiple times. And how do we get coordination across healthcare, county, local CBOs and all of it to really meet the needs of individuals. So this effort, we have Aging and Disability Resource Connections in California, but they're not statewide. These really provide some core services designed at helping people navigate services, get information and referral, prevent exacerbation of healthcare conditions, and prevent institutionalization or help people move out of institutional settings to the community. But it's not statewide. So we've been piloting different concepts about what we could do to help support more robust information and assistance and navigation throughout the state. And so one of the pieces we're doing is our CalCares project, which again, it's just a pilot in a few counties, but this one's focused on caregivers. And we really want to see how do we improve coordination between the healthcare sector and local community-based services. We know that there's a lot of caregivers out there, but there's a lack of identification. Many people don't even identify as a caregiver, one. And two, healthcare side is not necessarily identifying or screening for caregivers and helping them connect to services. And so how do we increase awareness about caregivers? And how do we help improve coordination and referrals between that healthcare and home and community-based services sectors to really maximize that caregiver engagement, improve referrals, and access to resources that might be available. So we are working on the increasing awareness, increasing navigation, and then really educating caregivers with the educational pieces they need to play this role as a caregiver. So this is something that we're working on right now, and we should be releasing some information to really learn how caregivers do access referrals, how they do navigate local systems, and what roles the providers currently play. And then we're going to be coming up with some ideas for improvement for access to those services. The next one is our CALS Connect program. This really is what I wanted to talk about around community health workers. We've been looking at how do we utilize community health workers to help individuals navigate services. In this case, this program is specific to those with Alzheimer's and dementia and their caregiver. And so these community health workers in 3-4 different counties have been piloted to really look at a No Wrong Door approach to develop dementia-capable home and community-based service systems for those living with dementia and their caregivers. And so we've had community health workers that have been these navigators for both the caregiver and the individual with dementia, getting them connected to services, walking alongside them and supporting them, helping them with eligibility to programs, helping them sustain the services once they get them. And we are showing some very positive outcomes and improved access to services, reduced caregiver burnout, and what have you from this community health worker. The other community health worker one is newer that we're setting up. And this is really, it's a 2-year federal grant. to advance California's No Wrong Door system to really streamline access to long-term services and supports. And we have it in some pilot counties. And really what we're trying to do is pilot these CHW navigators, discipline aging navigators, that then could be sustained through Medi-Cal and Medicare. So we are going to put together a toolkit. We'll be sharing it with the other network, but really wanting again to support our aging network partners to better coordinate with managed care, with healthcare providers to really help support individuals across the different sectors. And so our goal here is really increasing awareness of LTSS, increased access, reducing caregiver burden, and reducing emergency room visits, hospitalizations, or institutional placement, and just overall increased quality of life. And then really looking at that sustainability piece through Medi-Cal or Medicare. So I'm going to stop sharing if I can figure out how to do it. And I will put some resources in the chat here for all of you.
I put them in as you were talking, Anna.
Say that again.
I put them in as you were talking. So I was putting the links in the chat while you were talking. So hopefully I covered all of them. You can look through and see if I missed any that you wanted to include, but
Thank you.
I was trying to do it in real time. I wasn't always successful, but carry on.
So that's a little bit of an overview, but I'd love to hear what stood out. I didn't really talk much about homeless and housing, but that's also a, growing population. We're seeing that as one of the faster growth in the homeless population is for older adults. First-time homeless often associated with some kind of exacerbation of a healthcare condition, a new disability, where people are just living on the edge and then falling into homelessness. But questions, thoughts?
So I was hoping first, Brianna from Opportunity Junction is a host site for the Healthcare Career Pathways that is no longer getting funded by the state. So when you talk about needing to develop our workforce to serve older adults, I think Brianna and Empowered Aging were doing some incredible work around developing that workforce that was supposed to be serving older adults. And I'm wondering what you think that we can do in the absence of funding on evidence-based programs that have shown incredible results. What do we do? We know the recipe. We don't have the funding. So what now, Anna, to put you on the hot spot?
Yeah, no, that's and I'm not as intimately involved with this initiative, but right now we're working with AARP on an older adult employment study piece. So what I would like to be able to do is connect you to that information once it's up and going. I'm not sure exactly what level they're going to go into. We know it's a need. We know it's an issue. People are having to work longer than ever. People need new skills sometimes to be able to be competitive in the workplace as an older adult. And so I know we're looking at that with AARP as it's a private public partnership. But
also, Anna, the funding actually was supporting caregiving that works component. So it was supporting the training of folks who are providing the care, person-centered care for the aging adults. So it was not necessarily employment for the aging adults, but the training for people who are providing the care in skilled nursing, et cetera.
And so was that for paid caregivers or family caregivers or both?
Yeah, for nursing assistants. It was a program for preparing more nursing assistants, spreading it around, expanding it throughout the entire state to create more caregivers.
And was that funded? What was the funding for that?
It was $5 million to expand to different counties. We actually didn't receive the funding ourselves. Debbie, we were part of the program that was mapped in the Master Plan on Aging. So we didn't receive the funding. We were just the model for what was funded to expand it beyond.
Was it ARPA funds, the American Rescue Plan Act funds?
Actually, I don't know the answer to that, and I'm sorry.
So there may have been some funding from ARPA, and I think it was through HCI, which is no longer
Yes.
HCI. It's now
It was
something
HCI.
else, right?
Okay.
And they opted to spend their money in different areas on workforce development instead of on with the certified nursing assistants who are going to be caring for elders. So we have this crisis that's happening where we keep talking about workforce development around caregiving and supporting older adults as they age, because we all know that we gained 3 decades of life expectancy last century and we did nothing to plan for it in our healthcare systems, our built environments, anywhere. And so this was one way that we were providing evidence-based training programs for people to be able to move into this workforce space, and then we pulled funding for it. So, I mean, that's one area, and Anna, you and I can talk about that offline. Certainly, we have plenty of things that were funded with ARPA funds that disappeared, but this actually was not disappearing funding. It was in HCI, and they opted to spend it elsewhere, which is unfortunate.
Yeah, and thank you for the clarification, because I went to employment of older adults for some reason, so thank you for the clarification.
Okay.
But we were just talking about this morning. So I did put CalGrows in there, which is a host of trainings that were developed, and we're actually working with UC Davis right now to make more of them publicly available at no charge. But the conversation this morning was like, what if we could take these and work with the chancellor's office or the community colleges, and to basically, see, could this be helpful and towards credentialing and credits, right, for college credits. So
oh, well, you got Mandy on here and she's listening, so
Yes,
right?
that's right. I'm ready to raise my hand.
It was just an idea that we talked about, and I'm like, now I need to go to my peeps and see if what we can do.
Yeah, I would love to connect with you because our colleges provide a lot of great programs, both short-term, certificates and degree programs. So definitely would like to speak with you more. I'm
Great.
from Contra Costa Community College District.
Yeah, and we can connect you guys via email. And when I say we, I'm thinking Uche or Meg, because you guys have all the email addresses. But the other thing I wanted to note, because we've got Sharon in the room, and we've got Ann in the room, and we've got Rhonda in the room, and we've got Rebecca in the room. Like, we have these folks who are in our traditional healthcare system space, and they are seeing, and you all jump in and correct me if I'm misstating this, they are all seeing a huge amount of older adults in their hospitals, in their healthcare systems, in their emergency departments, and they don't have the tools they need to know how to get them home safely so they don't come back, so they're not receiving primary care in the emergency department, so that they get care in the home, so they get transportation services, they get nutrition services, like all that you talked about, Anna, in terms of this being this broken system. And so the master plan for aging is trying to identify what are all the different things, how do we organize them, how do we get people to know what they are, where they are, who's eligible for what, blah, 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 blah. So what guidance do you have for these hospital and healthcare systems that are traditional systems in nature that don't know how to access all that, where to go, what to do, what they could, how can they get training in their workforce around what are home and community-based services, long-term services and supports, how to access them, who's eligible, all that?
Yeah, this is one of the one of my favorite things I ever did at the local level was really help to bridge that healthcare and community base. And I think the first thing you do is look to see who's in your aging network and disability network and reach out and connect. You really want to really think about how do you bridge that hospital to home piece, right? And so what we know is those life transitions times where people are in the ER, are hospitalized, end up being critical times where you can connect them with the resources. Ideally before they leave is always ideal, because once they leave, then the follow-up, they may not be as receptive to getting the assistance. So the more you can have these navigators, whether it's someone that's already in-house, and I know you guys have a lot of pressures on you, and there's a lot of things that you need to do, but the more you can either train your staff in-house or work with a local aging and disability network partner who's willing to support to help bridge that hospital to home piece. So whether it's training your internal staff on all the aging resources disability resources that are available. So, and have them develop the relationship with those organizations so they know exactly who they can reach out to at that organization that knows what you're trying to do and is going to be a reliable partner, right? Maybe it's a matter, of funding, the aging network or some of those organizations to be the navigators. That's why we're really encouraging them to connect with their managed care plans, right? To be able to bill for enhanced care management, supportive services, CHW's benefits, right? So building out navigators either within your setting or within the community partners so you can share in this, I think is key to it. So my program was one where we were a CBO, an independent living center with a navigator, and we had a data agreement, and we were able to go in there. The discharge planners or nurses would make referrals to us. We would go in there every single day, meet with the people while they're in the hospital, start a rapport, follow them home, basically connect with them and follow up and continue to provide support. The benefit of connecting them with someone in the aging network, like Debbie, like your organization or the Area Agency on Aging, is that often it's not just a one-time deal. Once they get connected there's this ongoing support for them to prevent that readmission, to prevent exacerbation of health conditions. So it's just in everyone's best interest to get them connected to those networks for that ongoing support.
Thank you.
So
Yeah. and I
follow up,
think-
Debbie, to that.
Yeah.
Of all the sort of amazing resources you shared with us around like county profiles and landscape analysis and all this stuff, is there one that has like a, I don't know, got a listing, but sort of what is that network out there? I mean, I think what happens in healthcare is people make relationships with one or two organizations, and then they don't necessarily know the whole picture of what's out there to assist aging adults and those with disabilities, and where also they could connect with.
Yeah,
I just don't know. Yeah.
And what county are you again?
This is Contra Costa. I'm just
Okay.
thinking Contra Costa. But I mean, if obviously you're a state agency, so I don't know if you have mapped out some of these resources statewide and can look for things in your particular county, or I don't know if that's the Area Agency on Aging's responsibility or if that's something they do, but I'm just kind of curious.
Yeah, and I'm going to put in the HCBS. Wait, can you guys click on these links that I'm putting in here? Am I just putting in? Okay. Yeah. So the HCBS digital landscape
Yes.
tool for your planning purposes, I would go there, bring up Contra Costa and see what organizations, a starting point. Now it's not everything, but at least it's a starting point for you. Don't you have an aging and disability resource connection in Contra Costa?
No,
No,
we do
Contra
not.
Costa.
We do not have one in Contra Costa. So there is no, I mean, we tried to do that in 2017 and we applied and we got shut down. And I think the county was sort of over it after that. So they didn't apply when it became available again. But we don't have the ADRC model in Contra Costa County. We have a fantastic 800 number. For those of you who don't know this, 800-510-2020 from anywhere in the county, 800-510-2020. You get connected to information and assistance, which is housed at Employment and Human Services Division under the Aging and Adult Services Division. There is a social worker who answers that call and can help you navigate in real time what services somebody needs, where they live, what they're eligible for. And that's everything from low income telephone bill reductions, PG&E bill reductions, to in-home support care, to transportation services, all of those things. Much more comprehensive and depth of knowledge than going to 211 and just getting a number. It's actually somebody who's a social worker who's going to ask all the right questions and refer you to all the right places. So 800-510-2020 is the place in Contra Costa that knows all the things. And if you're in Alameda County and you call from Alameda, you're going to get their information and assistance line.
So you think, because you do have a 211 in Contra Costa too, but
We
you're
do,
saying
but
it's
it's
not as
not answered by a social worker who's going to interactively ask
Yeah.
questions to get you to the right resources. You have to know the resource you're looking for when you go to 211. You can go not knowing anything except I need help when you call 800-510-2020.
So the other thing, and not that any of us want more commissions and committees, but what I did before there was anything like an ADRC is we just intentionally created a table, and maybe you've already done this, where we had an aging and disability table that included, there was a healthcare council in one county, they called it, which was really healthcare, but they also invited all the aging and disability kind of service providers to the table. Others, which is aging and disability cross collaboration, where we would cross train each other. So every meeting, each over the year, organizations would present on what they do, what their eligibility is, how to access resources, and then you send the right people to those meetings. And so people start making those connections and relationships.
So we're over time and we're losing people, but I am so appreciative, Anna, of you being here, and I will let Rebecca take her meeting back.
Well, Anna, I just want to thank you because you're such a wealth of information. I think we could talk for another hour. Um, so many questions, and all of us who have who are aging, but also have aging parents. I'm taking notes furiously.
I'm with
So
you. I'm with you
yeah.
there. Yeah.
So and this is so difficult to navigate, and the whole long-term care space is a whole nother ball of wax, Debbie, as you put in the chat. So very enlightening, and I think we will come back to this topic again and perhaps expound on some of these issues and dig a little deeper.
Thank you.
So
Let me know
thank
how I
you.
can help. Thank you so much for your time.
Thank you,
Thank you.
Debbie.
Thank you. Thanks
Thanks,
all.
everyone.